Hello guys, this video is going to be about more detailed information, the process, what I went through, and things like that for me to get a spinal cord stimulator implanted. It's been a year and a half since I had my implanted. So I'm going to tell you what the results, what to expect, and things like that. Mine was implanted back in October of 2018. Here it is, April the 18th, 2020. So it's a year and 5 months or a year and a half by now. So far, it's working great. And what led up for me to get a spinal cord stimulator? I have had back problems going off and on for good 15 plus years since my mid-teens. Here I'm in my mid-30s now. So my back's been, off and on. And for the longest time, I thought, and the primary care doctor thought it was muscular, because they did CT scan and X-ray, didn't show nothing really causing back pain. But like once a year or twice a year, I end up sitting in bed for a year. I mean, for a week or two, very bad back spasm, and they they'll threw painkillers and muscle relaxers at the problem, and it did go away. Um, it wasn't until like good 5 plus years, I would say about 5 years ago, I was referred to go to a spine doctor. Now I went to the spine doctor not for my back, for my neck. I went to because I was seeing a neurologist for my migraines, and they did a CT scan and found that there was a bulging disc or two in my neck and the C-spine. And he said, well, we could treat the headache, but since he's the headache doctor, he don't treat the conditions of the spine. So I ended up going to the spine doctor. And I went to the spine doctor the first time, and they said, oh, you can do injection in the neck by the pain management doctor and see how that goes. Didn't look like surgery was needed for the neck or anything like that. And I think the second time I went back to the spine doctor after the neck injection, my back was really bothering me. And I thought, you dummy, you had a back doctor. Tell him about back problems. And every symptom I listed, nerve, I didn't even know what sciatica nerve pain was. I just said my legs were bothering me. And the lumbar area of the back was really bothering me. And all the symptoms I was talking about, he said, you probably have a bulging disc in your back. I could tell you right now, without doing any imaging, the symptoms you're telling me. So he ordered a CT and an MRI and an X-ray of my back, and sure enough, there was two bulging discs. One didn't. The third one kind of almost looked like it was fixing to bulge out, but it didn't. I guess they didn't classify it as a bulging disc. So I had imaging done, and for the longest time, I had epidural steroid injections done in my back, and of course they gave me tramadol and Zenaflex, or sometimes they switched it off to Flexeril. Flexeril for me works a little bit better than Zenaflex. Because the migraine doctor was also said Zenaflex would be good for headaches, but it didn't work for me very well. For the muscle in the back of the neck that was causing migraines. And it wasn't until 2017 and 18, really 2017, no, I back up. I had back surgery sometime in 2016, around there somewhere. My back got a little bit worse. They did a lemiconnectomy or something else. It was like two procedures done at once. They cleaned up the area because they found bone spurs that was bothering me, and they also cleaned up the area with the nerve by the spine. Decompression. I think it's decompression, and that helped for a long, for a good while. And I don't know, sometime down the road, I injured my back again, and it was starting bothering me. And that was 2017. Really got bad, and I was at the point of taking Vicodin, Soma, which is a muscle relaxer. Um, I was taking gabapentin, triptan, for the nerve. That was the sciatic nerve pain. And I went back to the spine doctor by all that time, and they went ahead and did some more imaging and found that the disc became herniated. I don't know I don't know the technical difference between a herniated disc and a bulging disc. To my understanding, maybe the herniated disc is a little bit worse off than a bulging disc. I don't know if they're really the same thing or not. I'm not a doctor on that. But a disc was pushing against the nerve again. So the spine doctor said, let's do a discogram and find out which disc is actually causing the pain. And for those who have never had a discogram done, it's painful. And the spine doctor doesn't do those, the pain management doctor does. So I went to the pain management doctor, we did that discogram. And what it is almost like getting an epidural steroid injection done. But what they do is they sedate you. I was sedated. And they inject dye in each disc that they think is causing the problem. But they also inject dye in a disc that's not causing a problem, a control disc. I don't know what the purpose of that is. I don't know if they trying to see if any fluid is leaking, or if it's agitating the nerve. So they sedate you and they do all this, and they kind of take you out of sedation, and you say, "Oh, that hurts," or "No, that doesn't hurt," and then it puts you back under again. And you really can't do nothing for a good week or two afterwards. And you have to have it in right after the procedure. They flip you over and they do a CT scan to see if the discs are leaking any kind of fluid, and luckily not. But they did found that the disc is pushing against my nerve. It was really bothering me. So I went back to the spine doctor, and this was going towards the end of 2018. 2017. And he said, well, unfortunately, there's only two medical treatment options available to you. You can either do a lumbar fusion, which is a very high risk surgery for you, very invasive, or you can do a spinal cord stimulator. And he said, I think you will have good results with spinal cord stimulator. But he said, for me to do a lumbar fusion, you have to lose some weight. He said it's going to be hell. It's a surgery from hell. For them to fix my problem, the discs that I was having a problem with, they had to go through the abdomen. So there's going to be a general surgery involved in that part. And then they also have to cut you up in the back. So I'll be sliced up front and back. He said, the recovery is good 6 months. You probably won't be able to work due to my weight and all, things like that. And I didn't take it seriously. I did not take the spinal cord stimulator option very seriously around that time frame, because I wanted the problem fixed immediately until my pain management doctor said you really want to stay away from lumbar fusions. And the spine doctor also told me this too. If they mess up, it's not something that can easily undo if it doesn't work. And one little mistake, you could become paralyzed. One little, nick, you can become paralyzed. And the more I did more research on lumbar fusions, it's really a surgery from hell. It's just something that you never want to go through. Is a nightmare. So, going into 2018, it was time for me to have another steroid injection. And like I said, by this point, I was taking a lot of pain medicine and muscle relaxers just to get through the day. I mean, I was in a lot of pain. Sciatica nerve pain was bothering me. I was on that gabapentin, triptan, whatever we call it. Um, and briefly, the pain management doctor kind of talked about. I kind of talked about it with the pain management doctor, about the spinal cord stimulator briefly, and that was early 2018. And then it was time to do another injection sometime in the summer of 2018. And I told him, I think about it and tell me more, more detail. My appointment was almost 2 hours long. Luckily, I was the last patient of the day, but he really talked. He answered all my questions. He told me, the pain management doctor said, I think you will have good results with it. You will be happy with it. Don't do a lumbar fusion, because he told me he sees patients that it did not help one damn bit. And people and he said most of the time people who have had back surgeries and fusions, their pain does not ever 100% ever goes away most of the time. So we talked about it. He said, let's go ahead and get the process started. The insurance company may require you to do some physical therapy. So here's he gave me a prescription for physical therapy, and you have to have a um, psychological evaluation, and I did that, and that turned out to be a clusterfuck on its own by the insurance company. So I did physical therapy, 6 days. As six visits. Blue Cross said, "Well, let's do physical." Blue Cross authorized 6 visits, and did it. And because I went 3 times a week for 2 weeks, and got all my medical records, sent it off to the pain management doctor. And then the next step was to do the um, um, psychological exam. And of course, I'm on Blue Cross Blue Shield HMO plan, so therefore on the HMO you have to have referrals to see people. Well, my doctor was keep putting referrals in with Blue Cross, and somehow it didn't work. Something went wrong with Blue Cross, and I played phone tag with them and did that bullshit. And I finally had the common sense to call the pre-authorization number instead of the customer service. I called the pre-authorization department, because they took forever for them to do anything about the referral. And the lady I spoke with, she said, I don't think you need a referral because you're in Texas. But here's a telephone number because that falls under the behavioral health part of the medical plan that Blue Cross doesn't manage at all. They contract that out to Magellan Health. So I called them 3 different times, trouble mixture. And the lady said, yeah, you're in Texas. No HMO referral is required for behavioral health benefits, because the insurance company can't put blocks to access care in that capacity. So I went for the psychological exam. They didn't ask too many personal questions. Really, the type of questions that they really asked was, do you feel the need to take pain medicine when you're not in pain? Do you ever abuse prescription medication or illegal drugs? And things like that. Do you suffer from depression, suicidal thoughts? Are you safe at home? They also asked, how do you feel with a medical device in you? Will you follow up with follow-up care or aftercare, whatever you want to call it? and things like that, what the real expectations are. And they were real nice. The place I went to, and all healthcare providers should be like this. They respected my privacy, and the lady, at the window, when you sign in, they didn't yell across the waiting room why you're here and things like that. So they do treat confidentiality very, very, very well. The place I went to for the psychological exam. So basically, that's all that was. They just asked questions and things like that. So that was done, and then you do the trial. My trial was in early October of 2018, and I had good results. Now, obviously, you got to understand this. You will have pain from the procedure itself. So they give you pain medicine for that. Then you taper off. I was given Vicodin or Norco and muscle relaxers. And, like the third or fourth day, I had good, I tapered off, but you still be sore. You still, because you have the device taped to your back and two lead wires coming out of your spine, and that's all taped up. So you will be sore, obviously, and have surgical pain. But like the third or fourth day, I went to Target and walked around for 3 hours, and I had very, very good results. I was really surprised. I was not expecting the kind of results I was getting. I mean, it took 85 to 95% of my pain away. And because I was texting the implant guy back and forth, he said, "Turn it up, walk around." Now, obviously, you can't bend over, twist, or anything like that, or pick up anything heavy while you have the lead wires coming out of you and the thing taped. But the generator battery went dead. So I went back there and they changed the battery. It just took them less than 5 minutes for them to change out the battery. I guess it wasn't fully charged, or they thought it was fully charged, whatever the case may be, during the trial. And I think my trial lasted maybe 5 to 9 days, somewhere around there, maybe 7, somewhere around there. And if you have good results, then you proceed to the surgery to have it implanted. So communication with the device rep is very crucial for this process for it to work. Don't be afraid to tell them, hey, this setting's not working. You change it. Don't ever be afraid to ask them that, because that's what they're there for. It's for them to program it right for you to get good results. Now, to my understanding, there's different spinal cord stimulators out there that does different things. Some older models do that buzzing sensation constantly. I didn't want that, and I told them that. Some implants out there, the technical name for it's a generator, but the spinal cord stimulator, some are out there that the patient really don't have to fuss with it and leave it. On the patient's end, there's not really much custom settings that they can do. They just set it and forget it almost. And I told him I want to be in control of that. More settings where I can adjust it to my level. What I wanted. I wanted more control. So they matched me up with Abbott, which is St. Jude Medical. They bought St. Jude Medical out. And they also have ones that's higher frequency, does different things. So, you got, the pain management doctor will let you know which one is suited for you. And, I have read on the internet where some people have to do multiple trials because that one particular implant or generator didn't do very good relief during the trial. So they changed it to a different manufacturer, and it did help them. So it's hopefully it works for you the very first time. It did for me. But like I said, don't be afraid to call that device rep up and tell him, hey, it's not working. Can you change it up? Um, because they do test it before you leave the hospital, but you drugged up. You know what I'm saying? When you get after the procedure, they turn it up the highest it will go for you to tolerate it, and things like that. And then Blue Cross Blue Shield did approve the implant. I had it done late October of 2018. I was really surprised how fast the insurance process um, gone through. But of course, I had all my medical records. I had copies of all that shit and imaging and everything done. And the pain management doctor just sent it off to them. Um, Surgery itself, yes, it does hurt. But it's not the worst surgery I ever had. I probably would say gallbladder or corporate tunnel surgery is much harder than this. Now, obviously, you can't absolutely no bending, lifting, or twisting after surgery for 6 months, for 6 weeks. So you can after that, because when they do insert it to be implanted, they do make an incision and they do cut that muscle to insert it. So you will be big time sore afterwards. So you're not gonna get any kind of relief for a couple of weeks after surgery, because you're gonna have that surgical pain. Um, and that, of course, then the trial and after surgery, that damn medical tape's gonna drive you crazy. It's gonna itch like crazy. It really is. I had staples on my incision. Um, Now, when I did the implant, I chose the rechargeable one because the rechargeable implant lasts longer versus the non-rechargeable. But they had to change it down the road, and I'll explain why in a second. But after, I thought I was thinking I probably didn't get good relief from the implant until probably maybe 3 weeks to 4 weeks after surgery. That's when it really um, got good relief. Now, after surgery, you will notice the area of your back is going to bulge out a little bit because there's an implant that was, there's a device there that was there to begin with, and you're going to be sore from that muscle being cut and things like that. So, to me, it was easier surgery versus having my gallbladder out or my hands being worked on for carpal tunnel. It was not as painful. Of course, like I said, you will have surgical pain. Don't minimize that. You will. You have to take it easy too. Ice helps a lot. So I would say maybe a week and a half after surgery, if I remember correctly, I tapered off of the pain medicine, the heavy duty pain medicine back then, and muscle relaxers. And my goal, and the pain management doctor's goal with the spinal cord stimulator for me, because everybody's goals are different, but for me, was to have a reduction of pain medicine and reduction to having injections done in my back. So that was my goal. Everybody's goals are different. Um, like I said, beforehand, I was taking Vicodin, Soma, gabapentin, all that junk, and you know, in all honesty, the longer you on pain medicine, that kind of pain medicine, your chances are being addicted to it gets higher and higher and higher. And then there's also a point where your body gets used to it, and where the medication doesn't work very, what do they call it, intolerance to the medication, where it won't help any longer. If you take it long term, it won't help to reduce the pain any longer. Your body just gets used to it. Intolerance, I don't know what the terminology is. Then you have to have more dosage of it for it to work. The tolerance to it just gets out of whack. If you know what I'm talking about, if that makes sense. Um, so throughout 2019, into 20, throughout end of 2018 and 2019, I had very good results. Now, of course, you will have bad days and you have good days, and you will have bad weeks and good weeks. So a huge reduction for me was, you know, a big time reduction in pain medicine. I was taking, I stopped Vicodin and I was put on tramadol. But I took tramadol off and on too when I couldn't take Vicodin. Of course, like working and driving a car and things like that. I really took the Vicodin when I was absolutely in severe pain, where I knew I was not going to leave the house, like that in those situations. But in situations where I had to get out of the house and go to work or a family function, what have you, I took the tramadol because I am able to function on tramadol without being messed up and tired and all that. Because for me, Vicodin makes me extremely tired and drowsy, but the tramadol doesn't do that to me. Now, everybody's different. Some people, tramadol does make them sleepy and tired and drowsy. Not me. It doesn't impaired me. Vicodin does. So I have gone a couple, different times, a whole week without taking pain medicine, and sometimes I have to start that up if I move a certain way and it irritates my back and things like that. So, like I said, you have good days when you don't have to take any pain medicine, and you have bad days where you do have to take pain medicine. The stimulator is not designed to take 100% of pain away at 100% of the time. So don't think that will happen. Don't think you're going to get a stimulator. Oh, you never have to take pain medicine ever again. That's not how it works. Now you will have a reduction of pain medicine, but I have multiple medical issues that I have to take pain medicine, like for migraine and neck pain. So the implant stimulator does not work for migraines and neck pain in my neck, because they implanted it for the spine, for the lumbar area. So one hand, I have reduction pain medicine for my back, but I still have to take once in a while tramadol for my back or migraine headaches. And also, so I read somewhere that some people thought that once you get a stimulator, you never experience pain in any part of your body. That's completely false. You can go stump your toe and it's going to hurt like hell. It's not designed to take that kind of pain away. If I'm making sense, you can slice your hand open, yeah, and that's going to hurt. It's not going to take that kind of pain away. And also, it's not designed to take muscle pain away from your back. It's not designed. It's really designed for like nerve pain and pain from the disc itself. Nothing muscular in other parts of the body either. But so you can't expect that at all. And some people who do suffer from back pain, it may be just muscular instead of the actual disc in the spine and nerve pain. So, like I said, it's not designed for muscular pain. It's not going to prevent you to feel pain from your toes or hands or neck. It's just for that lumbar area. Now, they can insert the leads different spots up and down the spine, because you can't have a spinal cord stimulator for the neck part. apparently. So you just have to go into this knowing that it's not going to take 100% of the pain away 100% of the time. And don't think you never have to take another pain pill ever again. Um, like I said, you have good days and you have bad days. Not too long ago, I went to the dentist for a cleaning, and I got out of the dentist chair weird because it was low to the ground, and I hurt my back. So for that particular week, I had to take Tramadol and muscle relaxers because my back was so stiff and hurting. Even though I turned that implant up a little bit, it just didn't take 100% of the pain away. You know what I'm saying? Also, you could turn it up, the intensity, you can turn it up a little bit higher if you're going to do a lot of activity like walking and things like that, or if you're going to be standing on your feet for long periods of time. I'm able to, for me, since I was having a lot of back pain, I had to sit down every couple minutes, going to the store, things like that. But now I'm able to walk around that damn store for hours on end without any kind of problem. Then, mid 2019, around there somewhere in the summertime, I did notice that my implant was having trouble charging. Like I said, I had the rechargeable implant, so therefore you had to charge up once every week or so. And it was having problems connecting. And I went back to the pain management doctor for follow up anyway for my neck injection, and the implant guy was there working on another patient. And they asked me, do you need to talk to him? I said, okay, yeah, I talked to him. I told him, it's kind of having problems charging. And the pain management doctor and him thought, it could be scar tissue forming. And he said, well, there's a couple options available to you. He said, well, we can go in there, the pain management doctor said he can go in there and clean up the scar tissue. But if it's a whole bunch, I would have to be referred to a general surgeon or a reconstructive surgeon to remove more scar tissue if it's really bad in there. And the other option is just to convert it to non-rechargeable. I'm like, oh yeah, like the insurance company's going to pay for that. But sure enough, they submitted the information, and Blue Cross Blue Shield say, hey, we will pay for a replacement. And on October the 1st, 2019, I went ahead and changed it to non-rechargeable. All they did is they kept the implant and the leads, and all they did is to change over the battery pack from non-rechargeable. And I told them, the charging, because on the rechargeable implant, it's real picky. The paddle has to be directly over the area where the implant is for it to make a good connection and charge up. And I told him, it was getting fussy, and I told him I had to put a pillow behind me, and I had to lean back in the chair for it to be put a little bit of pressure on it. And he said it's because of scar tissue. Not everybody has scar tissue. It just happened to me because, I had back surgery prior to this in the area where they implanted. So there you go. And like I said, Blue Cross said we will pay for a replacement battery pack, and sure enough, I had it done. It was outpatient. And the guy did tell me if some way or another that the insurance company didn't pay for it, that they would be able to get it covered for free, because apparently it was under warranty. If I understood him right, I was drugged up during that time when they told me about that after surgery. But the replacement surgery was not as bad as the original surgery because the muscle the device was already there. Now, of course, I was sore after surgery, obviously, um, but I was really surprised. I was able to go back to work within 3 weeks um, of it implanted. Uh, when it was converted to non-rechargeable. So I'm happy with it. Um, there was nothing. Uh, Keep in mind, there was nothing wrong with the device itself. The reason why they needed to change it over because I had scar tissue that was having problem charging, which was not a big deal. I mean, with the pillow behind me, you know. Now, if the insurance company wouldn't cover the replacement surgery, I wouldn't have had it done. I would have to live with it. Um, it didn't cost me a penny. Um, but I'm very happy with it so far. Um, Now, when I went back for the second or third follow up, they did make some programming changes where I was able, because I was having sciatic nerve pain, where I was able to control it a little bit better, where I could have the left leg on and the right leg off if my left leg was bothering me. I could adjust the intensity in both legs independently. You know, I can have it stronger in my left leg and the right leg barely on. That's the kind of programming that they fixed for me. Now, like I said, they do make spinal cord stimulators out there where the patient really don't have nothing to do with that. They just have off and on basically. But I wanted more control. Like I said, I wanted more control in different settings for me. I didn't want to rely on going to the doctor because it was far away from me. You know, my pain management doctor's about 40 miles away from me. Um, so I thought about that too. you know, um, I didn't want one of those things where you said forget it. I wanted one where I could change the settings based on my particular need at that particular point in time in that particular day. So I'll show you what the controller looks like. This is basically the trial kit bag, what they give you for the trial. But since I bought back my charger and the controller carrying cases, the device rep was able. He was real nice. He was able to give me one of these cases for because I gave them back my cases back, even though they were mine to begin with. After my original implant. So this is what it looks like, just like the trial. That's the magnet is to shut the implant off immediately if you need to stop it. I haven't needed to use it at all, and um, also the it has to do with also it has to do with them programming the implant itself too. Uh, with a special magnet too, what they use on their computer. And of course, it comes with the charging. Now, I got this little case from the Dollar Tree. I bought this first before they gave me this. Because he didn't give me the carrying case until when I saw him on the follow-up appointment. Because they just gave me the controller in a big cardboard box from the hospital. And this needs to be charged, but it's a Apple device. I don't know what you call this thing. iPod, iPad, iTouch. Yes, I know you did battery. And of course, it has its own little programming icon right there. That's the only thing that's installed on this thing. This thing does not communicate out to the outside world. It's on airplane mode. Um, and it connects via Bluetooth to the implant. And sometimes I have to put it on my side over here Sometimes it will connect from like this. If I'm sitting like this and this close range, it will connect. Sometimes I just have to put it a little bit closer. So it just depends. Let's see if I can do this without showing my personal information, because it does have my name on it, my last name. But here it is. I don't know how well y'all can see that. So I keep it on 15 most of the time. Now this one, this particular, because it's I don't know what the hell you call this device, but it's Apple. I know that for sure. Um, that it has a sleep timer on here. So if you want to turn it off, if you want to lay in bed for, before you fall asleep, you can leave it on, and it will turn itself off up to 60 minutes. Uh, Normally, since I got converted to the non-rechargeable, I don't feel the pulses whatsoever. Now, the rechargeable implant, if I turn it up extremely high, I did start to feel the pulses. But they have it programmed where I don't. But the guy said if I do want the pulses, because around 17 to 20 on my old implant, I was able to feel the pulses. My very, very dull pulses. Dull. It wasn't strong. But when I turned up to 25, I absolutely did feel like I was being zapped. It's not painful. It really feels like your foot's asleep, but it feels like that for your entire abdomen and back, and in your body as well, in your hands and toes. That tingling sensation, that's what I call it. But they did program a setting in there where I can have the pulsing going on. But they said since this is a non-rechargeable, they don't recommend doing that constantly because it will drain the battery faster. But he said if you want to do that in like for 20 minutes to an hour long, at a time, that pulsing, he said that helps with severe pain sometimes, especially sciatic nerve pain. So, so I do have a program setting in that where I can do that. And also, it's kind of weird. I can make it where I can do the pulses in my legs. I can do it like the left leg only or the right leg only, or both. Um, so that's kind of neat. I charge this once a week. Um, like I said, this is not connected to the outside world. You can't make phone calls on it. Um, you can, I guess, you can download other apps, but I would not trust that whatsoever. You don't know if those apps have any spyware on it or anything like that, because this does contain the serial number to the implant. It contains the settings to the implant, and other things like that. So you can connect it to Wi-Fi, but I would not do that whatsoever. Um, but I was able to change the wallpaper on here and things like that. I keep it on. I mean, if you want to say the battery life on this, I suppose you can turn it off and turn it back on when you need to. Um, but like for instance, if I'm going to do more activity, I bump it up maybe to 17 to 20. Less activity, I keep it around 15. 15 for me seems to be the magical spot for me to get good relief. Also, sometimes if you do turn it up, you don't feel the relief immediately. It may take 30 minutes to an hour for you to feel the difference. So it's most likely you're not going to feel immediate relief from it, from uh, adjusting the strength and noticing any kind of relief in pain. And the purpose of the stimulator, and to my understanding in layman's terms, what it does, it disrupts the nerve signals, pain signals going up to your brain. And that's what it's supposed to do. Um, so I'm happy with it. Um, I'm very, very grateful for the device rep who I have. He's very nice. I text him any questions I have. He responds. If he doesn't respond, it probably means he's either with the patient or in the operating room with the doctor. So the communication with the device rep is extremely important. And I watched one video, and the lady was not getting good results with it, and she was saying that the nurse was telling her, just crank it up, and turn it up to the highest it will go. First of all, that medical nurse should not be telling the patient that, because that nurse is not trained on how to program and make this implant to function right. That's the place of the device rep. So no doctor or nurse should ever tell the patient, just crank it up as high as it will go, without consulting with the device rep. Because if you crank it up the highest it will go, it may cause adverse problems. Like you may get a headache, or it may damage the nerve. Things like that. Mine is set up to the highest it will go for me is 25, but the guy can program to go up to 30. But it's programmed to stop at 25 for me. So I can never make it go above 25 on the intensity without them doing a programming change. But don't never let a person who's not trained in this to tell you, just crank it up, at all. Now, the doctor may suggest, hey, let's see if the guy can make a programming change. But the doctor or the nurse they can't make a programming change. They don't have the computer to do that, or the software to do that, or the training. That's the purpose of the device rep, to make those changes. And of course, I've been to my doctor where the device rep who I deal with couldn't make it, so they sent another person. And the lady, I seen her a couple different times too, and they're real nice. And they supposed to be asking you tons of questions. Hey, do you feel relief like this? Is it working for you? Is it not working? Don't ever be afraid to tell them, hey, it's not working. Don't be ashamed of that, because they can fix it. They have a huge amount of different programming settings they can do for you. For instance, on that the pulsing setting, I was feeling it in my stomach, in the upper chest area, a little bit, and they fixed it. Because apparently on the lead wires, there's like a little tiny paddle with little different spots, and then they turned one of those spots off, so I didn't feel it in my upper stomach and the lower chest area when I do the pulsing. I have used the pulsing setting a couple of different times, for a good 20 to 30 minutes, and it felt pretty good afterwards. Now, I don't turn up so high where you feel like being electrocuted, so I keep it pretty low, that I can tolerate my particular level. Everybody's level is different, but the normal operating range of this, I don't feel no pulses at all, unless I change the setting to the pulsing setting. And like I said, I can adjust it. I can make it stronger on the left or the right, or both at the same time. Now, on my non-rechargeable implant, I did start to feel the pulses when it's cranked up, like I explained, when it was cranked up around 17 to 20. Also, I felt the pulses if I stepped on the concrete too hard, or sneezed, or coughed. And it didn't bother. It wasn't painful or anything like that. Like I said, it kind of feels like a sensation like your leg is asleep, sort of. But it's like that for the whole entire body almost. Like I said, I'm happy with it. The only regret I have about it was I didn't do it sooner in 2018 when I was told about it. Also, I would recommend for you not to do this during the summertime, the trial and surgery in dead heat summer when it's 100 degrees outside, because you're going to get sweaty and you can't shower off very well with all this medical tape on you. So probably do it when it's cold or during the fall time. But other than that, like I said, I'm happy. And it's not a miracle device. It's not a 100% cure all. Your medical problems, it's not going to go away. So at the end of the day, I still will have a bulging disc or herniated disc. At the end of the day, it's still going to push against the nerve. But it's just a tool to help. And so far, very successful. It works wonderful for me. So you had to have real expectations going into this, and just don't have the mindset, oh, it's going to take all my pain away and never have to take a pain pill and never have to have an injection done ever again until the day you die. No, it's not like that. I went from having four injections in a year for my back because they do them spaced out. I only had to do two so far, two last year, and I had one done already last month. So it's a huge reduction. Pain medicine, steroid injections, and things like that. But it's just, what I'm trying to say is, don't expect it to take your medical problems away. You're still going to have your medical problems at the end of the day. This is just a tool to help manage the condition. Your condition will still be there. You still will have bulging discs. You still will have nerve problems at the end of the day. Now, I did when I did have it first implanted, we did try to stop taking the gabapentin, and I had mixed results. So I still take it for it to help me better, because I do have sciatica nerve pain flares up from time to time. So if you do have any questions, comments, please post them below, and I will try my best to answer your questions about the spinal cord stimulator. And somebody may have posted on my old videos, how much did this cost me out of pocket? Both surgeries, the trial, the original implant, then the replacement, did not cost me one penny. My insurance company covered at 100% because beginning of each year, I already met my out-of-pocket deductible and co-insurance. It's very low. I think the last 2 years were $50 deductible. My deductible and co-insurance gets eaten up by the medications that I take, because I use the prescription coupons the manufacturer has with the medication, so I really don't pay nothing really out of pocket really most of the time. So by the fourth month of each year, my insurance pays 100% for everything. Thank God. Since I met my out of pocket. Now, speaking of insurance, if you are thinking about doing this, you need to kind of do it in beginning or mid-year. Don't wait until the end of the year to have this done. Don't wait till the end of the year to have the trial done and then the implantation, because you do the trial at the end of December. January comes around, your insurance resets, so you're going to be out of pocket more money. So do it, I would probably say do it mid-October, maybe September, the trial and all that get done and over with. So you don't have to be out of pocket when the calendar year resets. This has been long enough. If you have any questions, comments, please post them below.